Good evening and welcome. Starting with our top story this hour, Lebanon is coming to terms with the massive explosion at the port of Beirut that has killed at least 137 people and injured more than 5,000. The death toll is rising consistently as Lebanese rescue teams pull more and more bodies from under the rubble. By Wednesday evening, the true extent of the explosion was there for all to see. 250,000 people are now homeless after shockwaves from the blast destroyed houses in the vicinity. Beirut's governor estimates that the city could have suffered losses to the tune of $15 billion. And there are also fears of food crunch as the port of Beirut was Lebanon's biggest trade artery. The blast also destroyed the country's largest grain silo. Lebanon's grain stockpile is expected to run out within a month's time. Tuesday's explosion was the biggest to hit Beirut since the end of the civil war. An ammonium nitrate stockpile has been identified as the source of the explosion. Lebanon's president and prime minister have promised accountability, but experts say that it is neglect and corruption at the top that led to this disaster in the first place. The government has put those involved in guarding and storing this toxic chemical under house arrest. Now, residents of Beirut say the city's hospitals now resemble slaughterhouses with blood spattered across corridors. The medical staff, who are already overwhelmed by the pandemic, are unable to tend to the wounded. The blast also prompted a Lebanese court to delay the verdict in the 2005 bomb attack in which former Prime Minister Rafiq Hariri was assassinated. Carol Yamin, Lebanese journalist, is joining us live from Beirut for more on this. Good evening to you, Carol. This is the third day of the tragedy that struck Beirut and Lebanon as a whole. How is Beirut trying to gather itself and garner some sort of normality?
Thank you for having us. Actually, this is a good question because so far the amount of devastation, of destruction is undescribable. You mentioned in your report the losses are amounting up to $15 billion. This is true, taking into account also the fact that we are under an economic crisis and the situation is very bad. So what we are trying to do now is still rescue the people who are still missing and also provide care to the injured. As you said also in the report, the hospitals were overwhelmed and also a lot of hospitals in Beirut were terribly destroyed by the blast. So all the patients were moved to other hospitals that are already overwhelmed by the COVID, also new wave that we were suffering from. So this situation health-wise is not really easy. Everyone's trying to cope. Also yesterday, a lot of people from everywhere went and took the streets. They volunteered since the morning to try and clear the rubble from the streets, which are covered in glass and rubble, in cars that are destroyed. The situation is horrific. I'm trying to find words to describe it for you, but actually we are now in one of the historic buildings in Beirut. This is the situation. I wish I can show you more. The situation is horrible. Blood is everywhere. And we are trying basically now to survive and see how we will be able to move forward.
Yes, truly shocking. We've all seen the absolute scale of destruction and devastation through the visuals. You are there on the ground showing us what's happening all around you. You have mentioned the hospitals. Which are some of the other facilities that have been most impacted? And how is the administration coping with it?
Yes, actually the hospitals were affected, but also the businesses. So as you know, Beirut is the hub, it's the capital, and also it's home to most of the headquarters in Lebanon, and also home to all the restaurants, the nightlife, everything. Actually, it's the heart of Lebanon, and it was shot in the heart. So the economic devastation is huge, $15 billion. This is a lot for a country that witnessed its currency being devalued by almost 80% so far. So the people actually who have survived, they were lucky. I don't know if we can call them lucky, because even those who have survived, they had their homes shattered, destroyed, and people who cannot even afford the price of food, I don't know how will they be able now to afford the price of renovating or fixing their houses. So we see a lot of volunteering. The administration, I don't know what to say. Basically, we're receiving a lot of donations from countries around the world. We had some field hospitals being built, which is helping with the wounded, because we have more than 5,000 wounded, as you already mentioned as well. So it's a huge number, and they are asking the minor cases not to come to the hospital. So if you have glass all over your body, it's better to seek to go to a pharmacy or something, not to come to the hospital, because they are overwhelmed. So we have the field hospitals. We have 3 at the moment. They're coming from many countries that are donating. But the thing is now, people are calling, and we had a visit today from French President Macron, who arrived and who went to check on everything on the situation. And one of the journalists asked him, and this is the voice of the people, they asked him, how will the donation be given? Because we don't trust the government. So the government that is being responsible for the neglect and for everything that's happening, how can you trust them with the donations? They will be stolen, basically. So he said that it will be kind of given directly to NGOs and to people. So we're hoping, and if you ask in the streets, the people, they are all hoping that the donations are given directly to NGOs or to the people affected.
Absolutely, Carol. On that, you have mentioned with the French president being there, countries worldwide have expressed solidarity with Lebanon in these times of grief and have extended help. How is that expected to be utilized, and will it be sufficient?
Actually, that's a really good question, only if I could answer it, because as I already told you, we still don't know exactly how it's being given. So if it's given to the government will have to assess the losses, will have to allocate funds to the people affected. Basically, I think they should start with the healthcare system, but still now it's still under the shock. So this is not very clear. What we are utilizing it for now is, as I told you, the healthcare, the hospitals, field hospitals, and also helping people rebuild their houses and their businesses. And now they are discussing the possibility of giving loans to Lebanese with zero interest. But this is still being discussed right now. So it's all being discussed right now. The decisions and the actions are yet to be seen day by day as this is unfolding. So.
Carol, thank you very much for bringing us all the latest there from Beirut.